when I knew something was wrong. I was urinating 9, 10, 11 times a day.
My periods became somewhat inconsistent and very long. Mine could go a month and a half, 2 months.
For the entire month, I had a period, and it was heavy the entire time.
It was the most excruciating thing that I've ever felt in my life. The pain would take your whole insides and just churn it and squeeze it and just push it, and it was hard.
I was exhausted. I did not feel like doing anything. I always had to look like everything is great because of what I do. I always kind of felt like I was living a double life.
You know, there's a certain amount of depression that comes with that.
And I'd end up having a miscarriage at 18 weeks. My gynecologist thought that the fibroid tumors was probably the primary reason for it.
As a female in a male-oriented industry, I was always kind of concerned that I'm going to have a really embarrassing incident. It was always an anxiety.
And all of a sudden, I just felt like this big, overwhelming something that came down, and what it was like clot, blood clot.
She had a dress on. It was coming down the dress and down into her shoes.
I was like literally standing in a pool of my own blood.
Some people was coming in the elevator. I had to like back them out because at this time there's blood all over the floor in the elevator.
It was really the most embarrassing moment of my life.
To be sitting, say, in a meeting, you get up to go to the restroom, and there's blood in the seat. And it's just so embarrassing, and it's like, I just can't do this anymore.
I was given the name of a top-notch doctor. He scared me. He had actually scheduled my hysterectomy. And he said, well, I already got you scheduled, and I just think this is the best thing for you. And I said, okay, I understand that, but are there any other options?
A patient should know all of the treatment options available to them, and then they decide what they want to proceed with. It's called informed consent.
My gynecologist told me that I had no other alternative. I said, there's got to be something else. She said, absolutely not, there's nothing else, and we scheduled the surgery.
Hysterectomy is the second most common surgery performed in the United States. 3,000 women every day in this country have a hysterectomy, and 3 of them don't survive the surgery.
At that point, I knew that he really did not want to discuss any other options with me. And then I found Dr. Lipman.
Get a second opinion. You need to hear about UFE. UFE is one of the biggest medical breakthroughs for women suffering with fibroids, and yet most women have never heard about it.
I've tried everything else. I might as well give this a try too.
The UFE procedure is safer than surgery, less invasive, shorter recovery, and importantly, they get to keep their uterus, which I think is significantly undervalued by many physicians.
This procedure gave me my life back.
Literally 3 hours later, finished.
No scars, healing time is short.
And now we have 2 wonderful boys, ages 4 and 2, as a result of it. So I would not like to think about my life being any different and not having them in my life.
I have my life back. What can I say? I have my life back, and I'm very, 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 very happy about that.